You want your grandmother dying like a little bird in some hospital room? Her translucent skin so thin you can see her last heartbeat work its way down her blue vein? Or do you want her to meet Chuck Norris?
Chuck Norris is a 63-year-old market trader from the East End of London. He presented to his GP, explaining that he had not been feeling right for the past couple of weeks. He complained of a tight feeling in his chest, and thought that he was having a heart attack. On further questioning, Mr. Norris added that he was having trouble sleeping, headaches, dizziness and poor concentration at work. He also feels that the other market traders want to get rid of him. Chuck reports that he has been worried almost continuously for the last 6 months as his business has been losing money and he thinks his memory is playing up. He is struggling to remember what he has ordered from his suppliers. Chuck is married with 2 grown-up children, is a social drinker who does not smoke or use recreational drugs. He has no medical or surgical history though describes himself as always a bit of a worrier. On examination, he had clammy hands, a mild tremor, tachycardia with normal heart sounds. He was near motensive and febrile and had a normal thyroid. His mini mental state score was 27 out of 30, losing marks for serial 7s, registration and recall. I advised him that his symptoms were consistent with an anxiety disorder, and that they do not mean that he's having a heart attack. I organized full blood tests and an ECG to rule out other causes and arranged to see him in a month. I arranged for him to meet with a practice counselor. At his next appointment, I advised Chuck that all of his tests came back normal. Chuck felt that the counselor was helping him to feel less stressed and anxious, but he still struggles to recall his order with the suppliers, and his wife told him that he had even called an apple a pear. A year later, Chuck came to see me with his wife. Chuck reported that he was feeling much better and that he did not think that there was a problem. However, his wife interrupted and said, "He is not his normal self, his memory has gotten much worse, but he plays down the difficulty. His speech is getting much worse, and he gets his words muddled up." When I questioned Chuck's wife further, she reported that whilst he can still wash and dress, he makes unusual choices and puts his clothes on back to front. He often forgets to complete minor tasks and has difficulty recognizing where he is when they go out. His mini mental state exam scored 21 out of 30. He is unable to give the date or day, identify the town or floor, and registering only 2 out of 3 objects and recalling none. I referred him to the neurologist for a thorough assessment of his condition. Chuck was worried that he would get dementia like his stepbrother. Chuck and his wife went to see Dr. Barnard, the consultant neurologist. He found that he had non-fluent speech with some difficulty finding words, and occasional grammar errors. He could follow simple commands but could only name 2 words beginning with C, in 90 seconds. He had no recall at 5 minutes and his mini mental state score was 21. His cranial nerve exam was normal. He had normal reflexes and no grasp reflex. The history and examination were consistent with dementia, but more information was required to work out which type of dementia he had. Chuck was given some leaflets produced by the Alzheimer's Disease Association. Chuck will be reviewed in 6 weeks' time by the consultant.